The tragic story of George Floyd's death reminded the world of the centuries-long issues faced by African Americans. The global roar that has followed reveals that humanity has the capacity for change and the will to end the unfair treatment of people all around the world. Activating Change Today, otherwise known as ACT, is Baxter's initiative to help fight racism, end marginalization, and advance social and clinical justice for the Black community. ACT is integral to Baxter's mission to save and sustain lives. We are hopeful that our work will play a role in addressing this persistent issue. Just Voices is a series of stories by the Baxter ACT initiative that will shine a light on Black men and women and their experiences with racial injustice in healthcare. These stories bring to life the staggering statistics and amplify the voices of the marginalized. The movement has begun. The focus is clear, and the time to act is now. We ask for your support, action, and courage to help end racial and social injustice. Healthcare is changing all around us. Lines of responsibility are being redrawn. Incentives are being reset. And care models are evolving. Health equity is at the forefront, and changes are desperately needed. Despite prior work meant to address the very same issues that the Black community in the US still faces today, the focus on health equity is paramount to protect the underserved. With the pace and magnitude of these changes happening all at once, we are naturally curious about what the future will bring. In this episode of Just Voices, we take a closer look at health equity and clinical justice, and we'll ask a market expert, along with several ACT leaders at Baxter, to provide their perspective.
Clinical justice means that any single patient has the ability to access high-quality care and get the right care that's meant for their health and well-being in the most trusted manner.
Joseph Gaspero is the CEO and founder of the Center of Healthcare Innovation, a nonprofit research and educational institute making healthcare more equitable. Let's start by understanding what equity means.
So the difference between equity and equality is noted in a famous image of three individuals looking over a fence to watch a ball game. Equality is when the individuals are different heights and they're looking over the same size fence. And obviously the shorter individuals cannot see over the fence, where the equity-based approach is understanding that different individuals looking over the fence might need different resources and different assets. And so the idea is that the shorter folks in the picture have the chair to stand on, to look over. Here in Chicago, a really visceral example of health equity is life expectancy. If you go 4 miles south or 4 miles west, look at the life expectancy rates between residents that live in Lawndale and residents that live in the Loop. Understanding that our zip code is the greatest predictor of one's health is alarming.
A team of Baxter employees sat down with Joseph to talk about the links between health equity and clinical justice. The question was raised: if we achieve greater health equity for the Black community, does that also mean that clinical justice is more likely for the Black community?
We know that the pursuit of justice is not always a linear path. It can be quite circuitous. And when you're dealing with matters that are clinical, that's scary. When you think about access, for me, it becomes more of a local discussion because that's the way healthcare rolls out. That's the way healthcare happens. I don't seek a physician out in California, I seek a physician where I live. When I think about that, then as an organization, as more of from a commercial leadership standpoint at Baxter, I have to think about whether or not building awareness and providing tools to the healthcare system is enough. Because if the system is not set up in a way where that is good enough to reach the marginalized population, then we have to think about what else do we need to do.
South side of Chicago just got their first Whole Foods a couple years ago. And so you think about diabetes and it's eat healthier. Well, that's very challenging for a lot of groups. Just access to things we take for granted, access to fresh foods and vegetables. You think about respiratory illness and some of the respiratory illnesses that make COVID-19 dangerous. Look at some of our neighborhoods, the air quality in some of our neighborhoods on the southeast side of Chicago. Chicago's no different than any other city. So health equity really takes into account the broader systemic obstacles and systemic inequities and barriers facing marginalized communities of color and all marginalized groups.
The COVID-19 pandemic brought to light inequities that strip away access from Black communities concerning care, education, and tools to help prevent disease. Readiness identifying and eliminating healthcare inequities is expected to lead to a more accessible quality of care.
I think it starts with introspection. I think it's really hard to bring true change to an issue and solve a problem without us identifying that it's a problem in the first place. There's going to be some really tough conversations. And we're going to identify the issues and the problems that have continued to persist. And in order for us to then bring that change, we have to understand it. And we're going to bring that change together. From the top of the house, from our CEO all the way down, we're working and striving forward towards that. I think when you look at clinical justice, in a large respect, it's the same thing. Across the continuum of care, we have seen that these disparities have continued to persist. Why? And what are we going to do about bringing forth that change together?
The changes happening today are not entirely centrally led, with heavy focus from both the public and private sectors. The fragmented efforts to improve healthcare for the Black community may increase speed, but without complete unity around a common goal, it's unclear if we are inching closer to the landmark moment we seek in the U.S. You can help Baxter and the ACT initiative progress towards health equity and take steps to bring greater clinical justice to the Black community. Visit Baxter's Activating Change Today website at baxter.com and click on Inclusion and Diversity for all the ways you can team up with Baxter and its growing list of partners to fight racial injustice.